Hanson, please can you tell us what are the experiences of the relation between patients and doctors in the world if you separate them in regions?
Well, there are many differences around the world in relationships, but I think it's basically 99% of the time the relationship between physicians and their patients is the same around the world. There is a concern that physicians want to give the highest possible health care that they can to their patients in an ethical way and based on research, evidence-based medicine. And that is around the world, regardless of the systems, the economic place that people are in various countries. The basic relationship between physician and patient is really very much the same, regardless.
If we speak about the responsibilities, if there is any error or fault in the medical field?
Well, if we're talking about patient safety and quality care, that is a concern, again, around the world. It is at various stages of recognition and development in various countries or various regions of the world. But it is very important, again, because ultimately we want the very best of care and the best outcome for our patients. Now, at times, we have what we would call adverse outcomes, outcomes that are not expected, outcomes that are not the ideal, that we did not want or expect. An adverse outcome is something that can come about because of the system, the healthcare system. Is the infrastructure there for the ultimate best outcome? Is the people involved, the number of people involved, and is that part of the reason? So many times we have to look at the whole system rather than looking at the individuals. Is it the fault of the porter who brings the patient into the hospital? Is it the fault of the laboratory that does the tests? Is it the fault of the radiologist or the technicians in the radiology department? Is it the result of the physician or the nurse? And you have to look, and most of the time it is not the fault of any one particular person, but it is a combination of putting that whole system together that has resulted in an outcome that is what we would call an adverse outcome, an outcome that is not the optimal outcome. And that is why when we look at outcomes that are not what we want or what we expect, that we don't go looking for individuals within the system of whom we say it is your fault. In much more, we should look at the whole system to say, how can we do better next time for the best of the outcome for the patient each and every time?
Thank you.
Thank you.